we want to talk just a little bit about how Chinese medicine diagnoses conditions. What are the conditions? These are the underlying causes of illness. If we imagined a line here, and on that line we have some little circles of various sizes, each one representing a symptom. When a person goes to a Western doctor, they find the most troubling symptom, the largest circle on this line, and focus in on it, and focus in further and further, such as using a microscope or magnetic resonance imaging, X-rays. And this is a valid and beautiful, wonderful system. But we look in closer and closer. Chinese medicine tends to do the opposite. It looks back and back and back, and seeing the context of what or where these symptoms are occurring and what's happening in a person's life. But we also use, in order to locate and understand, if we imagine underneath that line, we've got some other circles. And that's what we're looking for in Chinese medicine. The states, energetic states that give rise to the symptoms. And in doing so, as we say, we step back. We have 4 major things that we do to understand what's going on. We're looking, we're touching, we're listening, and we're feeling. So let's look at those in a little more detail. The most common diagnostic methods starts with getting a history, your personal history, your family history, your history of accidents, injuries, surgeries, etc. The main complaints, what makes them better, what makes them worse. We have a large number of questions to ask. The second primary thing we use is pulse diagnosis. The origins of pulse diagnosis goes back to a time when medicine was an exclusive thing in society, and the emperor and officials were honoured in such a way that they could not be seen or touched by just anybody. And so one of the stories is that the emperor, when he was consulted by a physician, that the emperor would put his hand out from behind a curtain, and also he could put a leg out as far as a knee. And so the only way of diagnosing apart from questions was to touch the pulse. And so a system evolved from this. We also look at the tongue. It tells us a great deal about digestive processes, but the tongue is actually like a little map. We have these little maps of the tongue, and the tip is the heart. Just back from the tip is the lungs. Central is digestion, sides, liver, gallbladder, and the very back would be kidney and the lower part of the body. So we look for changes in the colour of the tongue, the coating of the tongue, relative dryness, any bright areas, and so forth. Abdominal diagnosis is not used as much in Chinese medicine as it is in Japanese herbal medicine. And it tells us just through areas of tightness and pain, we're able to find out which organs are involved. So put all together, these systems allow us to understand those conditions that exist under that line, and provides us with the basis of choosing acupuncture points and herbal medicines.